I'd like to, at this time, invite the presenters from the tracks to come to the front so that we'll be all ready to go. And each of you will have about 3 minutes to present the action plan that you created in your track today. We know that one of the things that we want to do is to act, and so the conference will continue after today, right? So why don't we have, come on, go ahead, and we'll let you introduce yourself and the track represent, and there you go.
I'm part of the food group. We had Food Matters, John Booker. Our action goals were to create a society that recognizes food as medicine and provide the population with access to safe and healthy foods. And we're going about it with 4 things. Find and recruit people that are eligible for SNAP, food programs, and Meals on Wheels, etc., participating in finding it through clinic screenings and working with perkers like the CCOs who can help develop messages to encourage people to sign up. 2, expand programs that link veggie prescriptions, voucher programs with mobile markets located at health clinics like Legacy, Good Sam, and others like Care Oregon. Bring multiple health system partners together to talk about to scale, and thinking about including both larger systems and small independent health clinics. Work on data collection of the impact of these programs so that we can build a momentum. Number 3, facilitate connections with businesses who are interested in philanthropy and supporting food access partnerships that go beyond just writing a check, like some of the Sisters of Road partnerships we talked about in our group. Identify businesses like B Corporation businesses and community benefit organizations that want to do more than write checks. And number 4, mobilizing existing resources that can support nonprofits, conduct nutrition education, and other food programs by identifying instructional kitchens that could be used, training trainers like FAME as an example, and using services like 211. Thank you for your time.
Okay, so I was in the Healthy Communities room. We had a lot of great discussion, talking a lot about issues. We all drew very beautiful pictures of what we thought a healthy community looked like. I think it was great to see that we all had a good idea of what that was. When we thought about how that worked and how that impacted communities, a key issue that really came up for us was the fact that when you develop a really wonderful, beautiful community that's great for everybody, oftentimes it gets more expensive and we have problems with displacement, gentrification, and whatnot. So really, in terms of making sure that these sorts of investments in these sorts of communities that we create work for everybody, a key issue and helping make sure that there's an equitable component to this is really working on housing and affordable housing. And so that was, we had 3 sort of key areas that we focused on in terms of improving healthy communities. Housing was one, empowered communities was another, and also parks and nature in the neighborhood was a third. So I'm just going to talk about the housing one because that was really where I think we spent a lot of our time, and certainly is tied to the need for empowered communities as well. So talking a bit about that with our panelists and knowing what's going on in the state, Oregon is one of 2 states, Texas is the other one, that actually bans a practice called inclusionary zoning right now. And so inclusionary zoning would give local jurisdictions the ability to plan their towns and cities in a way that would be able to say not only can we have residential housing, housing in this particular area, but this housing has to be a particular mix and it has to be affordable to particular income levels and whatnot, so that we could really have a great tool for making sure that our communities are equitable and we're not displacing people when we do make them better. So that's kind of what we focused on in terms of saying this would be a great strategy, overturn the ban on inclusionary zoning. So part of that, some more specific action items that we decided, that we identified that would really need to be done is reaching out to community leaders and organizations to create a coalition, recognizing that there are already a couple of organizations working on this. Really, we need to build the movement. We also need to write the 30-second elevator pitch, trying to explain why it is. And certainly I know what inclusionary zoning is, but trying to get that message across and why we need to address this issue in 30 seconds, always a challenge, but always a first step in trying to start an issue like this and really making sure that we're thinking about it in very basic terms and being able to articulate what it is we want to do and why it is we want to do it. Assess the political feasibility and meet with legislators. There's a reason why we have this ban, and it's because a very powerful lobby implemented it. So there's political capital that would need to be spent there, and obviously a lot of strategy that would need to be sort of developed and thought out before we would undertake something like this. and then research the benefits of policy change and work to communicate those benefits as well. So again, it's kind of an abstract concept, but one that I think we know is going to have a lot of value. So how do we talk about that, and how do we make sure that we have the numbers and the research to back it up? So that's it that we had for that. Thank you.
I'm Mike Huntington. I was part of the Universal Healthcare track, and our recommendation was that we can do better, use its resources to build awareness and funding for a study bill known as HB 3260. It was passed in 2013 to evaluate different models for achieving universal health care. And for those of you who are interested, I have several copies of what the bill consists of, but basically its principles support the idea of the best care for the most people at the least cost, which is another way of saying the triple aim. There are principles, and I'll just read a few of them. There's about 20 of them, but the first 6 are that whatever the system is, should provide universal access to comprehensive care at the appropriate time, that it would ensure transparency and accountability, that it enhances primary care, that it allows the choice of healthcare provider, it respects the primacy of the patient-provider relationship, and provides continuous improvement of healthcare quality and safety. So you might be curious, what are those 4 plans that would be studied? One is the current system, including the Affordable Care Act. And of course, we can't know the full effect of that for now, but we know certain things about it. It will still leave 30 million people uninsured by 2030, 31. It definitely has some problems. It will study, this bill that I'm talking about, will study another plan entitled Government Administered Publicly Financed Medicare for All. That's the second plan. A third one would be a public health benefit option administered by state government, which allows individuals to choose between a public option and private insurance. And the fourth one was added, and it's based on Senate Bill 972 in 2011, which would provide essential benefits delivered through private insurance that would be funded largely by a sales tax. So we can do better to use its resources to educate the population and help secure funding, $200,000, for the bill so that we could do this study.
Hi, everyone. I'm Jesse O'Brien. I'm here on behalf of the Cost and Quality Group. So it won't exactly shock anybody in the room to hear that healthcare costs too much and delivers too little for what you pay. It's a complex problem, but one really basic thing that contributes to the problem is the fact that it's incredibly difficult to figure out what you're actually going to have to pay for healthcare services. There's a fundamental lack of transparency. The Institute of Medicine has studied this and said that about $105 billion a year in waste in our healthcare system can be attributed to unjustified price variation between providers and a lack of competition on price. So we think, our group talked about a lot of possible solutions to this. We talked about this as a cultural issue. There needs to be a cultural shift among providers and patients so that patients get comfortable asking about price and costs, and doctors get comfortable talking about it. But we also agreed that there needs to be some real fundamental policy change to break open the black box of hospital pricing and make it really open to everyone. And so we think some of the things that need to happen are, first of all, providers need to be required to post their prices, and by that I mean their prices as negotiated across all of the different payers, so all of the insurance companies, the public payers, and self-paying individuals. And there's a lot of details about what that would look like, but that's the basic principle. And then also that information would be available at the point of service, so that your doctor would be able to give you that information upon request. I don't know if any of you have had the experience of trying to ask a doctor for a price, but you can sometimes get a blank stare or have to wait for hours if you really insist upon it. This should also be paired with quality information, because we know that higher cost is not the same thing as higher quality. And in fact, there's practically no correlation whatsoever. And finally, probably part of the policy change will have to be getting rid of basically structures that are in place that prevent the disclosure of that information right now, so-called gag clauses in contracts between providers and payers. So there's already a movement building to put forward some legislation in the 2015 legislative session on this issue. If that legislation doesn't go anywhere, there's also a possible interest in running a ballot measure on the issue in 2016. Our request would be, we would really love to get more of the folks involved in the We Can Do Better community on board with this. If you're interested, you could talk to me. I work for OSPRG, the Oregon State Public Interest Research Group, but there's also an organization called Act Now for a Healthy Oregon. You could check out their website. They're on board with this as well. Thanks.
I have a large notes page. My name is Tracy Smith, and I come here from Moda Health today, and I'm presenting on the action plan for patient engagement. I spend all day, every day, thinking about what is patient engagement, what does it mean, and so our action plan is to first define patient engagement. What does it mean to us? What does it mean to providers? What does it mean to patients and advocates? And how does it look? Once we can define it, then we can start to measure it. If it doesn't get measured, as someone said in our group today, it doesn't get done. Measure it, figure out how to bring out this measurement into the healthcare system so that we can then do something about it. Another part of that is getting the quality measures of patient engagement established. These are very big goals. It's going to require a lot of collaboration between many organizations. We understand that this goal is going to look at the indicators along the spectrum of health, including the social determinants of health. A patient or person who's engaged in their health, who's homeless, living under the bridge, pregnant, their engagement is going to look different than me or you or anyone else, who's more highly activated and engaged in their health. But that doesn't mean it's not still important. So what do those indicators mean? I feel like that means a lot of looking at specific behaviors. Is this person who's living under the bridge pregnant, engaging in their health in what ways? Asking questions about being pregnant? Is she connecting with others? Things that relate to our health that are happening outside of the clinic, you might say. So once we get this information, we can then inform policy, drive change, redefine success in the healthcare system so that engagement is part of that and it's very clear, and improve health in communities and enhance the experience of care in general. Thank you.